everyone, and welcome back to Parenthoot Spotlight. I'm your host, Neha Garg, and I'm so excited about today's episode. Parenthood Spotlight is our way of celebrating remarkable individuals who contribute to the world of parenting with their expertise, passion, and wisdom. Today, we are lucky to have someone truly special, a neonatologist whose insights and care have personally made a difference in my parenting journey. He's none other than Dr. Hemant Sharma, who also happens to be Rishan's pediatrician. Doctor, welcome to Parenthood Spotlight. It's such a pleasure to have you here today.
I'm so thankful, highly obliged. I've been, called up for this Zoom meeting, for this podcast, and I wish like I can help other babies like yours to, to sail through a journey of parenthood, especially during the first 2, 3 years.
Thank you so much,
So,
Doctor. And before we jump into our discussion, let me quickly share what's in store for our listeners today. We'll be tackling some of the biggest questions and concerns that new parents have, from introducing solids and managing teething to busting common myths about neonatal care. So grab a cup of coffee or maybe just a bottle of water and let's dive in. Let's start with your story, Doctor. Neonatology is such a fascinating and challenging field. What drew you to this specialty and what's kept you inspired throughout the years?
uh, it did just like didn't start initially. Initially, I wanted to, become a medicine specialist, adult physician. Then
Yeah.
during my MBBS time, I found out like I have a special attraction towards small kids.
Uh-huh.
And somehow, I used to play with them. And pediatric at my time was a very, it was a end branch, and there was nothing called neonatology that time.
Uh-huh.
Like very few people used to do neonatology. Pediatric was an end branch. You do it for 3 years and you're done.
Right.
And then slowly, when you see, I went for internship. Internship, I saw that yes, there are a lot of kids and who really needs your help and sympathy and empathy. And pediatric, I found out that the small vulnerable babies, especially the small ones, they need the doctors the most.
Right.
And something was there, like I had a habit of chatting with parents, and I loved it. I used to
Yeah.
talk to them, and then somehow I started learning the language what the newborn speaks, and they really speak. They really speak. They are not dumb. They are very smart kids, and they really speak. And they, once you know what they want to tell, then you listen to them, and that
Right.
drove me to neonatology. Initially, it was a little difficult. Like they don't tell you everything, but they say that I'm not well, and
Right.
sometimes you feel they are not well, but they are really well. So that
Right.
that that thing you have to judge. And initially it was quite difficult. Slowly, we get hold on to small things. And later on in my in pediatric training, when I saw that, see, uh, saving an old man, you save a guy alive for a year, and
Right.
it's an old machine. So you repair the machine again and again and again. A small baby, a small kid, like 5-year kid, if you make him healthy, he is healthy for next 60 years. It gives
Wow.
you a lot of joy. It gives you give you a lot of joy, and the joy drove me to neonatology.
Wow. And I imagine working with such tiny humans, and of course, their very worried parents, can be both rewarding and daunting. Could you share a moment from your career that has stayed with you, something that truly touched your heart, and you're like, wow, that is why I'm here?
Uh, it happens a lot of time. It
Yeah.
happens like we sometime the small things that see when a baby's a newborn comes out, we
Yeah.
have hardly a half a minute.
Yeah.
Either that can be if you cannot do things, it will be devastating. And
Right.
if you really manage them well, they get saved. They get saved. So there's a baby with us. I don't want to name the child, but
Yeah.
yes, the child was born preterm. He stayed with us. Actually, she stayed with us for a long time, and then she went home.
Right.
And then after a month, she came with some cough, and she told that my child is not feeding well, and she had some cough. And I
Yeah.
told the child doesn't look well. He said, डॉक्टर साहब रात को दूध नहीं पिया है, थक गई है, रो रही है, अभी सो रही है. The child has not fed well. The child is tired and now just sleeping. And I said, okay, wait a minute. for half an hour and I'll reassess the child again. And after half an hour, the child was not there. I also got busy in my work, and somehow I got her number. And when I was going home, while driving back, I sort of thought that this child was not well. And I called her, and I asked him, how's the child doing? Sir, baby is doing well, and we are feeding the child with a dropper. I thought that this child is 3.5 kg, and feeding with a dropper is something very strange.
Yeah.
The parents were good, and they understood what I was telling them. I said, see, feeding a 3.5 kg child with a dropper is not a good sign. I think you should come back.
Yeah.
At least we'll see. If required, we'll do something. If not required, we'll just let you go back home.
Yeah.
You don't believe me? As soon as they came to the hospital, the child just turned blue, crashed.
Oh.
We had to do CPR. There were no hurt for good like 10-15 seconds. We had to do CPR and do a resuscitation. We have to give oxygen through ambu bag.
Yeah.
And this child is doing magnificently well.
Huh.
So well that you relieved. And this same thing happened to the same child 3 times.
Oh my God.
Similar thing. So now the child is 2 year old, doing absolutely well. Absolutely means absolutely well.
Wow.
And eyes on the cake was that their previous child had some cardiac defect, and the child succumbs to that cardiac defect even after surgery also. So this child was precious to them. They were not very affording, but this child was precious to them. That's why they listened to, they believed in us, and that stays with you. That, see, we could, like God gave us that power to snatch the life from death. So that stayed
Right.
with us for a long time.
Wow. Wow. I really love how personal and human your approach is, doctor. It's clear that you know how much you care about not just the babies but also the families you work with. It's really really heartening. And I can say that because I received that care and love from you firsthand. So thank you once again for this. Mhm.
The people who work with babies, I think they are like that. Most of pediatricians should be like
Yeah.
that only.
Yeah, yeah. Now let's get into some popular myths and questions that every parent hears or wonders about, especially here in India, where advice often comes from everyone, from grandmothers to neighborhood aunties and uncles. I'll
Yeah.
throw some myths at you and you can set the record straight. Okay.
Yes.
And first up, about holding babies. Is it true that holding them too much can spoil them?
Mm, I don't think so. See, there are two way to approach this thing.
Yeah,
Western people, they like to like the people who live in Western countries, they keep their babies separate,
right.
and they say that if you sleep with the child, there is an increase of a risk of SIDS, sudden infant death
Yeah,
syndrome.
yeah,
In India, we have never seen such things, and there are other, like, other causes of sudden infant death syndrome also. If the baby is awake, there's no, like more the baby cry, the insecurities creep in their brain, and they don't trust you well. So I'll say holding babies and not letting them cry is the right way to do, right way
right.
to go about. Care for your babies as much as you unconditional love should be there. However, they should not be, fussy. But yeah, when they are young, like less than 2 years, nobody knows that they've been fussy. Don't give in to their unnecessary demand, but do make them comfortable. Hold them, make them sleep near you. Yes, at a distance, and especially if there's a joint family, there's no harm. See, what I see from our experience, my parents have holded me nicely. Am I a bad person? No. Am I a spoiled guy? No. Like,
Yeah,
I don't do anything that should not be done. And
yeah,
same with other people, same with you, same with my neighbors, same with my cousins. Everybody has been holded them by their grandparent, great grandparent, and their parents nicely. Like,
yeah,
they didn't let us cry. And our kids also, my daughter is quite, a couple of years old now. I have holded her nicely. She's not stubborn. She's not a spoiled kid at all.
yeah,
So I think so, it depends on baby to baby. Don't give into unnecessary demand. But yes, loving them unconditionally is right thing to do.
yeah. And on that note, they also say that letting kids cry, letting babies cries make their lungs stronger. Is that true?
That's in fact contrary to it. Baby should cry only when they are born. So when they are born, yes, cry is important. That opens up the lung. Not after that. Never after that. In
Okay.
fact, if you let the baby cry, they swallow a lot of gas inside, and those baby will have a lot of gas, and they will have a lot of colic, and they will
Oh,
be crying more often. So it's a vicious cycle. In fact, if you make the baby not cry, if you keep the baby calm, babies will be more comfortable.
right.
So don't let them cry. And there's a psychiatric phenomena that babies, how good adult we are means that how we are reared up. When we are kids, if we are not taken care of well, we get insecure, and that
Right.
insecurity stays, and the neurons develop that way. And later in our life, in our adulthood, we will be insecure. We will not trust people. We'll feel that nobody get love. So in your childhood, those neurons should develop, those circuits should develop, where you feel that there is a lot of people around you that help you and they care for you. So a caring environment is important. Nobody should let their kids cry. No.
Yeah, but sometimes it so happens, like you mentioned, colic. So we've heard so many parents, who go through this cycle of colic. They're like, do कुछ भी कर लें, हम कुछ भी कर लें, बच्चा चुप ही नहीं होता है. He or she keeps on crying, and that's the only way to deal with it. Let the child cry, cry, cry. So is how to deal with a colicky child?
See, colic is like gas, and
Hmm.
that's a part of newborn life, and it will be there. Every baby who is born will have some colic at some point of their life, and
Right.
not all colic are pathological. Pathological means disease.
Yeah.
I'll say, a disease, colic, if the child is like so much panicky that he don't sleep day or night, do anything, the baby don't stop. But believe me, 99.9% babies have some colic, but they are normal. Normal means, see, if you babies need warmth, they need comfort, and they sometimes need skin to skin. What we try to do, we try to keep the baby away.
Right.
If you hold the baby on your tummy, if you keep the baby, there should not be much of gas. If the baby full, you feed them nicely, give them a burp, let them have some tummy time, and sometime, a little rocking movements, or you can have a small drive. Or sometimes we say, babies enjoy music also. They the baby, like Abhimanyu was, he could listen what mother was listening. So
Yeah.
same way the baby, and one thing is, baby usually have colic in the night time. Why?
Right.
Because in utero, when the baby is inside in the womb, the mother was moving in the daytime. So
Yeah.
in the daytime, baby had rocking movement all the day, and
Right.
at night it was sleeping time. The baby was a little active during night, in the tummy also. When the baby comes out, so daytime he knows that okay, rocking time is sleeping time, but at night the baby becomes active again. So that
Right.
time you need to have, and that happens in first 2 3 months of life. So gas is a normal part of newborn. Colic is a normal part of newborn. Not all colics need medicine, and most colics can be treated without medicine. Without medicine, you give skin to skin contact. You feed the baby before the baby cries. If the baby, see, babies also have anger issues. So and they cannot, how do they express their anger while crying? So
Right.
if you feed the baby before crying, they will become calm and they will not cry. And see, when they cry, they have more gas. So it's a vicious cycle. If it is very difficult, then you can try pacifier also, but it
Yeah.
should be hygienic. It should not be a dirty pacifier. It should be
Right.
very hygienic. You can try white noise, a soft music. Sometime even you can keep a handkerchief, a cloth that is dipped in your breast milk near your baby, so that baby is feeling secure.
Right.
And if you have more than one people in your house, everybody can try KMC. See, when you usually we see baby, जब गोद में होता है, when the baby is on your lap, the baby is calm. The baby is on the bed, the baby starts crying. So that
Right.
is not because of the gas, because the baby is insecure. He wants that warmth. Then you give that warmth,
Yeah.
and that
Okay.
that happens to every animal. Even
Right.
during the night, every animal come back and they hug around and they sleep. That's
Right.
what we have to do with our babies also.
Right. Right. That's so
But
insightful.
yeah, babies, the gas is there. Yes, if you drink a lot of milk, there will be gas, and baby don't know how to pass it.
Yeah.
Slowly, in couple of months, they know how to release the gas. Sometimes you can do a little exercise also. Just fold the knees over the tummy and they can pass their gas. But in couple of months, they'll all know how to pass the gas. And believe me, after third month of life, less than 1% of the babies will have colic.
Oh,
Medicine, no medicine has found to be helpful. People have tried gripe water. With gripe water, I don't know. Initially, the older gripe water used to have alcohol, and after taking alcohol, everybody used to sleep, and parents used to feel like, oh, relax, that my baby has slept. In India, where you cannot trust what the component of the medicine is going to be, especially if it's unregulated, and it has not been found to be beneficial in any of the study. Even that colicate drops has not been found to be beneficial. So we usually say, don't do anything, don't let the baby cry, and you break that vicious cycle, the baby will be well.
right, right. And doctor, on the topic of, crying, baby crying, when you are, especially for a first time parent, be it the mother, be it the father, the signs and the language of the baby, as you said, babies speak to you. Probably they speak to you. They don't, definitely they don't speak to the parents. So how do you decipher what they are trying to say when they are crying? Like what does you can feed them, you can make them sleep, but what else do you do when the baby is crying?
Just hunger is not one thing that make the baby cry. they
Yeah,
they can be uncomfortable also. So you have got a new cloth that has something here, a tag that is rubbing their neck.
yeah,
It's uncomfortable, it's not cotton. So most important is the first cloth that comes in contact with the baby, it should be a cotton cloth, and over that it can be a woolen or something. Sometimes you tie the, you make them overheat. It's very
yeah,
cold, it's very cold, you put on a heater and you put a lot of clothes. So that time the baby might feel that you awkward, they might we also feel pukes. So baby also feels the same way. So sometimes it's sometimes very cold, sometimes very hot, sometimes they are hungry, sometimes they're that something is irritating them. Sometimes it's just a ant bite, a mosquito bite, that's doing a lot of itching, causing a
right,
lot of itching, and the baby is uncomfortable. So you have to see a lot of things. If you feel that baby is or you have overwrapped the child, just relax him a little. Believe me, babies feel cold as much as we do. Babies just need one extra layer, nothing more than that. If you are comfortable in a shirt, baby needs a shirt and a layer above it. If you are in a sweater and a layer above it. Not too much, not excessive. Sometimes you put on woolen things without a cotton, and the woolen thing is so irritating that baby will be crying, crying, crying all the time because it is itching him. You have
right,
to find the other causes also. It's not just the colic. And
right,
if a baby gets calm on your tummy, that means it's not colic, it's something else. Or it is just the baby is insecure, if the baby is anxiety. And sometimes what we do, we put the heater towards you put a blower and you put a blower towards the baby, and the baby can't breathe and it's crying then. You have
right,
to make the room very comfortable. You have to possibly, if you can have a thermometer in your room and put a temperature of like 24, 25, 26. That's the ideal temperature. In that, the baby don't need even a lot of clothing also.
okay, okay. And you talked about mosquito bites, so I want to ask a question about mosquito bites, especially in areas like Delhi NCR where there are a lot of mosquitoes. How do we save our babies from mosquito bites? Do you recommend something for them?
If you can make the baby sleep in a mosquito net, that's the best thing.
Yeah,
See, that's the best thing. Other than, if you cannot, sometimes the babies are outdoor, it's difficult to keep the baby in mosquito net all through. You can apply those roll-ons, or this small good night, what we say, the
patches.
electric good night. Yeah, that will help. So, or the electric bats that can reduce the number of mosquitoes in the house, that will also help.
Okay, okay. And
Yeah.
talking about their fragrances, etc., it's safe for the baby, like the all out, it's all outs and good nights. They have that fragrance coming out of them.
See, usually they are not harmful for humans.
Yeah,
They're not harmful, and they are in such small quantity. They usually do not harm babies. So we
yeah.
can, run on good night. That I don't think so. There's a problem with that. But the best thing is put a mosquito net. And there are a
Right.
lot of mosquito net. There's a big mosquito net. The whole bed come inside, and
Yeah.
you can use the electric bat also to reduce the number of mosquitoes in the room
Yeah.
also. So
Yeah. Yeah.
try doing all those things also.
Okay.
Try to not open the have a what you say a net in your doors also. So
Yeah.
netted doors reduces the number of mosquitoes.
Right, right. So you were saying reduce the number of mosquitoes rather than, using something on the baby. So that should be the
Yes,
first resort,
first thing. Yes,
according to you.
if not
And
possible, try both.
okay, ठीक है. And doctor, what about, I this is something very, like I had this question for you when I came to you. What about fragrances and essential oils? If a parent is used to using some of those things, can they be safely used around babies?
If your baby do not get irritated,
Yeah,
sometimes some fragrance might have alcohol, and alcohol is a volatile liquid. It can just baby can smell that and become irritated with that. So
right,
better if it is avoided in especially in the earlier few months of life.
right,
Better. If not, you don't apply a strong fragrance. A mild fragrance won't harm the baby much.
right, right. And what about hair colors, doctor? Is coloring our hair safe?
Hair color do not harm the baby at all. It stays on your hair, and within a first wash, most of things get washed off, and the dye remains in your head. That do not harm the baby at all.
Thank you for clearing that for us. Now, should babies use pillows, doctor? If yes, at what age is it appropriate? There are so many pillows that we hear about, rye wala pillow, mustard seeds, and head shape theek ho jayega, things like that. So, is it
See,
safe?
those babies who stay flat. What we say, if the baby is not supine, there is an
Yeah,
increased risk of SIDS. We
right,
keep the baby supine, and that
right,
keeps the baby's head to get flat. And for
right,
those, we need lot of pillows. What I suggest is you keep on changing the position. You don't put the baby prone. The thing is, you should not make the baby sleep at tummy. However, when the baby is awake, baby can be on the tummy. But
right,
when the baby is sleeping, the baby should not be on the tummy, but baby can be on the sides.
right.
And when the if the baby sleeps supine, and when awake, you give him tummy time, sometime over your tummy also. Tummy time
Yeah,
doesn't mean the baby have to be on the couch or on the bed lying flat. He will not like it. You are lying down, you put a pillow on your back and just on a slant, you will keep the baby on your tummy, or somewhere your parents or somewhere
yeah,
in-laws who can keep the baby with you.
yeah. Right.
Uh,
And doctor, okay, now coming to I think one of the most controversial topics that we hear in child rearing, breastfeeding versus formula. What's your take on it?
Breastfeeding is gift of God. It cannot be replaced by anything. Formula feed is a basically animal derived milk, and that's for that animal.
Hmm.
Somehow human have decided to take others human milk, even when the mother is giving a lot of milk. It would be a crime if we deny a baby of the breast milk, because apart from just nutrition, it gives you a lot of things. It gives you immunoglobulins that give you immunity. It's a natural vaccine for first few months, couple of years, in fact, to the baby. It's tailor made. It is like specific for their child's needs. Some babies are born with a small weight, and those mothers have a lot of proteins in their milk. And some babies have a good amount of weight. Their proteins might be a little different than the smaller babies. So it's tailor made, and it if the baby feeds more, by milk by itself get thin. If the baby feed less, the milk become thick. And the milk also is different. It is like fore milk and hind milk. It's like a thin milk with lot of water that quench the thirst in the first half of the feeding, and then later half of the feeding it becomes a thick hind milk that gives lot of nutrition. So never formula should be encouraged. Only in circumstances where human milk is insufficient, mother's milk is insufficient, or there's contraindication, then
Yeah,
we should give to you could allow formula. As far as insufficiency of mother's milk is is a matter. Usually, mother's milk is not very insufficient. We do not have confidence, and we misuse the power of imagination, and we do create a lot of anxiety that I'm not a good mother. I'll not be able to feed my child. My milk will be a little less. It is never there. It's never there. Have you seen any animal who feeds other animals milk? Never.
Yeah.
Formula milk is definitely just is a modified animal milk only. It comes from cows. It's not certain made in laboratory. It's just a cow milk. It's modified with some added calcium and some added, and a lot of fancy things. Those all fancy things in a very, very high amount is there in mother's milk.
Right.
It is beneficial for baby, easy to digest, has decreases the incidence of constipation, in decreased incidence of diarrhea, decreased incidence of pneumonia, you know, earache, gives a lot of satiety. Apart from just nutrition, attachment with the mother comes with breastfeeding only.
Yeah.
Mother also lose a lot of weight. During the delivery, they have put on a lot of weight. That is why, because they have a lot of stores to feed the baby. If the baby will not feed, the store stays with the mother.
Right.
Usually, some women think that while if they feed the baby, they will not be, in good shape. It's in contrary, if they feed the baby, they will be in better shape than before.
Right. Right.
So yeah, apart from nutrition, the emotional component also comes from breast milk. So you should never discourage breast milk. Formula feed only if there are significant distress to mother, or the mother is so sick that she cannot feed, or the baby has a lot of complication and you have tried everything and still mother cannot feed.
Right.
However, in first couple of days when there's a lot of pain to the mother and you don't have so good family support, or there's the breast milk is not sufficient enough and there's a lot of significant weight loss, we sometimes very occasionally advise formula, but not routine, not routine.
Right. Right.
So baby should be exclusively breastfed for first 6 months. After that, also, breastfeeding should continue, preferably to 2 years, and it can be prolonged as much as the mother wants. And after 6 months, complementary feed should be introduced.
Right.
Formula feed is never an option, and animal milk should always come after a year if possible.
Right. Right. So you talked about complementary feed, doctor. That was going to be my next question to you. What's the right age to start complementary feeding and to start offering water to the babies?
Best age is after 6 months. See,
Mhm.
complementary feeds in Western society sometimes they start when the baby start neck holding around 4 to 5 months.
Yeah.
However, babies cannot have a lot of nutrition at that age. After
Yeah.
6 months, baby get resistant to new food, new textures. So best time is to start somewhere around 6 months.
Right.
And Hindu culture at least, they have Annaprashan that is usually after 5.5, 5 to 6 months. So best
Right.
time is 6 months and above. If you're
Yeah.
a working mother, you can start introducing a little like a couple of weeks before, but not very early, never
Right.
earlier than 5 months, but usually at 6 months.
Yeah. Yeah. And doctor, I'm very interested to know your opinion on how can parents introduce healthy eating habits early on in their child?
Healthy eating habits is means healthy food, and
Yeah.
healthy foods come from your house.
Yeah.
uh, the less processed the food is, simple food is more healthy for your child. And believe me, babies don't know the taste. So if you don't need to eat sugar, you don't need to add salt to baby's food. Simple food, the food you eat at your house. Initially the texture can be different. It should
Yeah.
be a little liquid, then a pasty, and then solid, and over a 1 or 2 months maximum. So you start some food around like 6 months. You give 2 to 3 times in a day, sometimes 4 times in a day for like 2 3 days, and then continue that food also and introduce one more food after 3 4 days and make it 4 to 5 times a day. And then 2 times or 1 time the first food, the second time the second food, then 3 times the next food. Because babies, for babies, it's a new food. So
Right.
like if I start to eat Thai food, I don't like it on the day one. So babies don't like the food what you offer on day one. They will reject it. So you have to give like 3 times, 4 times, 5 times in a day for 3 4 days, and they start liking it then. So you
Yeah.
start from simple food like dal, water, or simple dal, or rice, or khichdi, or dalia, something like that. Potatoes do help, or a boiled potato, or a ripened banana, something like this, 3 4 times a day. Apart from that, fruit also, fruit in form of puree, or fruit like some fruit you have mashed fruit. And when the baby is like 7 8 months, you can start with finger foods also.
Right, right. And do you
Yeah.
have a favorite childhood snack that you would recommend modern parents should revisit?
Favorite childhood snack can be Cerelac, a homemade Cerelac.
Right,
And, a myth buster is that, those Cerelac, what you say, makhana based Cerelac or nuts based Cerelac are not advised. Even in fact, nuts are not advised for first 9, 10 months of life. It should be, introduced only after a year. So it should be a mix of cereal, a lot of cereals, and that should not be a washed cereal, a sabut chana, a black gram, or a wheat and a sabut dal, unpolished dal. You can sprout them. What sprouting does is sprouting increase the quality of the proteins. So
right,
क्या करना है आपको? You soak the dal and wheat and chana overnight. You soak them and then you let them sprout. In the daytime you can sun dry them, then grind and roast. That will be a sarak. That will be a snack. Apart from that, the panjiri or
yeah,
those sattu, what we used to eat when we were kids. They're good healthy snacks for child. We can give
right,
them, or you can make homemade mix of cereals. You can just grind them and roast them, and you can feed the child. Or
right,
a banana is also snack. Sometime even like with you can mix two things like a boiled rice, a good boiled rice, and apple puree or a
right,
pear puree. You can all mix them. You can give them pancakes. So
right.
they're tasty. You're tasty, and baby likes them.
Yeah, yeah.
But
Prishal loves
you
them.
know, artificial sweetness should not be there. You can
Yeah,
eat a few raisins also. Raisins are good for tummy. They'll keep the stool so soft. You can add them. And
right,
milk should not be used as a snack or an alternative to food feed, because even after 6 months, milk is known to cause a lot of constipation, and it causes anemia. Anemia is like decrease the iron concentration of your blood. So quantity of milk should be less, like 200 300 ml in a day, not more than that.
right, right.
Yeah,
Wow. Wow, that's a lot of counterintuitive, I think, insight that we have got. Now, Doctor,
yeah, yeah.
yeah, I
And
I want to talk about health management now, Doctor, especially fevers. Tell us when to worry.
fever, it's like a nightmare to all the parents. Whenever baby has fever, everybody gets very scared. Fever aa gaya, 100, 101, 102. See, fever is just a reaction of your body to a foreign, antigen. Foreign antigen means a virus or a bacteria that comes from outside, and it enters our body, and our body start fighting it. So
Yeah,
it gives a reaction, and grade of fever doesn't make a difference. That really doesn't make a difference. It's just how your baby is fighting that infection.
right,
So fevers, most of fevers are viral fevers. However, a few of them can be bacterial, and we have to find out that is it viral or is bacterial. So in a day or two, I cannot tell you. You have to have a lot of experience. So you have to go to a pediatrician, whosoever is nearby, to find out this is a viral fever. No, but I can give you a few examples. Mostly those, if more than a couple of members of your family are sick, especially everybody in your family has runny nose and cough. Usually they are viral fevers. If your
right,
child is otherwise active and having mild fever, and even a fever of 100 102, and otherwise the baby is active and the fever goes with paracetamol, it's usually going to be a viral fever. If
right,
your fever is prolonged and the child is dull, the child is not feeding well, or if the child had some respiratory problem, then it can be something different. It can
right,
be a typhoid. It can be a viral. It can be a pneumonia. That is a time you should definitely go to a pediatrician or a doctor nearby. But
right,
height of fever doesn't make a difference. And mostly, I'll say safe medications are paracetamol. Sometimes we have a habit of using methyl P or ibuprofen plus. I'll not say they're very harmful, but especially in dengue time, we should not be using it, because when the baby have dengue, there's an increased risk of bleeding. That time using all those strong medication might cause bleeding once in a blue moon. So we don't take that place. So if you are self-prescribing without seeing a doctor, then don't give anything about more than paracetamol. Paracetamol means crocin, Calpol, Dolo. Yes, you can give those medicine yourself, and then At midnight, if the baby has fever, you can give that medicine and that decreases the discomfort of the baby, and you can always come to a casualty or an emergency or a doctor's OPD where you want to go. So
Right.
fever is a reaction. All fevers are not dangerous. In fact, most of fevers are not dangerous, and most of fever go themselves without medication, like in couple of days. So I hardly use any medication for fever apart from Prosen.
Yeah. Yeah. And what temperature should parents consider giving a paracetamol at?
See, our normal body temperature is around 99. So below 99, I'll say not fever, but small babies who have like, especially in summer months, if they're putting on a lot of clothes, the temperature can be 99.5, 99.9. If the baby do not have discomfort, if the baby is otherwise fine, fever less than 100, I'll say it is more of an environmental fever or overclothing fever.
Right.
However, if the baby has not put on a lot of clothes and the baby has recurrent, like babies are used to be normal and now the fever is more than 100, that means yes, there's some fever. We usually recommend that either the fever is more than 100 or the baby is uncomfortable, or the
Right.
fever of 100 also has been prolonged, like an hour. Then we should give some medicine to the child.
Right.
So
Right.
lower degree of fevers, like some, if sometimes we try to do, we give paracetamol before the fever comes. See, paracetamol do not reduce the infection. It just makes the fever come down, and fever will come down only if their fever is high, somewhere around 100, 102, not even 100, 101, 102. If you give a paracetamol when the temperature was 99, it's going to, it works for 2 3 hours, and by the time the fever reaches its peak, if the its effect wean off and the baby again have fever, then you'll
Right.
say this medicine is not working. Actually,
Right.
this medicine was working, but you use it prematurely, and now when that baby really needs that medicine, the effect is gone. Then you
Yeah.
go for a higher medicine.
Right, right. And doctor, when in the changing seasons, there is viral all around, cold, coughs. Are there any safe home remedies that that you suggest that parents could use?
Most of the pediatric bodies, they say that no cough syrups, the cough syrup or over the counter cough syrup should be used below the age of 2 years, and preferably not below the age of 5 years.
Wow.
Preferably. Lot of studies have been done, and every study has found out that these cough syrups are as good as placebo. Placebo means a medicine, like something that did not have medicine but look like a medicine, like a sugar syrup. So they
Right,
do not have the only medicine that works is honey. The problem with honey is, packed honey can have botulism. It cannot be used in very small babies. However, if you can, you know, mix it with some water and you just make it a lukewarm, the botulinum toxin usually get destroyed, and you can use some honey in babies, especially more than 6 week 6 month babies. So 6 months to 5 years, frequent honey, a diluted honey, and you can add some adrak, a ginger or tulsi. If the baby is find the taste better, you can add that, and the honey is as good as any medicine, in fact better than any medicine in small babies. For and small, runny nose and all those things, usually nasal saline help. If
yeah,
it is, too much, then you have to see a pediatrician. He'll definitely advise some medicine. But a lot of medicine are not required, especially those antihistaminic. They have side effect and usually to be avoided in small babies, especially less than a year or two.
right. And generally, what are the major warning signs in a baby's overall health, doctor, that parents should not ignore?
There are like warning signs for babies who are acutely ill. If the baby is not feeding well. Feeding
Right,
well, every baby who is sick will not feed well. Feeding well is the baby feeding less than 75% to 50 to 75% of the previous food. If chapati and now the baby is not even eating one chapati, that means the baby is not well.
right,
Sometimes in fever they don't eat. You give fever medicine, and after fever medicine, if they eat well, that's okay. If
right,
the baby is not feeding well, small babies, they have breast milk, it's very difficult to find out if they're feeding well or no. If the baby is passing urine well, passing urine well means the baby is passing urine every 3 hours. If the
right,
baby is other feeding okay, passing urine every 3 hours, the baby is active, that means baby is okay. If the
right,
baby is dull, if the baby is not passing urine, if the baby has some respiratory distress, means there's a lot of retractions between chest and the tummy, or the baby has nasal flaring, the nose blow up like, mm, mm,
hmm,
So that if the baby behavior is different than before, that means baby is not well.
Right, right,
You'll find out that if the baby's behavior is well, the baby usually is well. If the baby's behavior is different than before, then definitely the baby needs a checkup.
right. And now that you say it, doctor, it also makes me, think of it that how do you differentiate between normal behavior, crankiness, and a medical issue? Like you're saying, the child is behaving differently, so the baby can behave differently when they are cranky also. So, ऐसे तो डर के हम
Crankiness, yeah, with some maneuvers, either you please the child or you hug the child, crankiness will go away within few, half an hour or 1 hour or a couple of hours, not even couple of hours of, mostly less than an hour. But when they are dull because of fever or some illness, they will be dull for a couple of hours,
right,
more
right,
than a few hours. If the baby is persistently dull, if the baby is persistently irritable, if the baby is not feeding well for like couple of hours, that means the baby is not well.
right,
Just cranky babies will be well now he's angry, but whenever the anger settles down, the baby will be fine.
right, right. And doctor, what's your take on using soaps, creams, and other skincare products on babies?
See, small babies, at least for a couple of months, like 3 to 4 months, no soap should be used.
Mm-hmm.
Shampoo should not be used because see, when this soap and shampoo accidentally goes on your eyes, so the babies just gag that time, and it's very difficult to breathe. I see a lot of babies who have turned blue just because they put some soap on the face. So
Right,
for babies, don't go outside. A simple water wash is good enough for these babies. For
right,
I'll say give them frequent bath, keep them hygienic, keep them clean, but not soaps.
right.
Creams, scientifically saying, I don't know. I don't know. A simple oil like coconut oil is as good as any other cream. However, baby cream can be used, but now a lot of news comes what fragrance there. Most more simple creams are better with less fragrance. I'll say that.
Right. Right. And doctor, what's one old school baby care practice that you believe still works wonders today?
Uh, Coconut oil massage, gentle massage, that is the best, and it has found to be helpful. It has found without like it do not have any side effects.
Right.
But it should not be vigorous. It should be done by mother or grandmother herself. A massage wali can do it very vigorously, and sometimes you see fractures in baby's arm or limbs, arm or leg, and and they sometimes confuse you with a lot of things that this baby is not doing this. They compare your baby with other babies unnecessarily. That should not have been done. So they give a lot of anxiety. If better if you do it yourself, and a coconut oil massage or an olive oil massage. One thing is mustard oil should not be used. It irritates
Mustard
the
oil
baby's
should
skin.
not be used.
Should not be used. No, should not.
Okay. And doctor, any fun or quirky parenting myths that always make you chuckle when you hear them that ये क्या बोल रहे हैं?
Uh, see, uh, बहुत सारे पेरेंट्स आते हैं, they say that we put kajal in the eyes, इससे आंख बड़ी हो जाती हैं, eyes get widen. That's a myth. That's all genetics. The people in Western countries, they do have big eyes, and they never have had a single kajal application in their eyes. So kajal application started with hiding their anemia. Now it has become a fashion, but small babies do not require it. And in olden times, kajal is also a good antiseptic. So they used to have a lot of conjunctivitis before, especially in villages. So for that, they started using kajal. But now, since science has advanced, we have all advanced. Infection, it's a little hygiene has come up a big way. We hardly see conjunctivitis. So I think so. In a age of Mercedes and BMW, we should not be running on a bullock cart. And there's a why I'm against it, because it can block your nasolacrimal duct, and that will cause a lot of distress to babies and the parents, and that later on might require surgery also. So what you're doing a lot of harm to your baby.
Right.
And then they put a lot of oil in their nose and ears and on the head. See, no oil goes into the skin. So putting hair will increase the dandruff on your baby's head. It won't and then brandy malice, like the baby was crying and we were putting a lot of brandy do get absorbed from the skin, and the baby get dull, and sometimes they get very sick also. all those things. When baby was having cough, we gave a lot of, just a little brandy. A
Yeah.
small brandy is too much for that small child. So I'll say all those things should not have been done. Babies, they use, gripe water for small babies. Gripe water have like, it used to have some alcohol. I don't know right now, but if you give
Yeah.
alcohol, everybody, I'll also sleep after having alcohol. Small babies will
Yeah.
definitely will.
Yeah.
So all those small things, I'll say. Uh, a myth is that my baby is not growing well. You know, मेरे साथ वाले जो है peers हैं, they are growing well. And see, I think my breast milk is not good. They've been feeding on formula, so they are chubby. Yes, formula feed make the baby chubby. That is true because animal milk is a little, stronger. It has more carbohydrates. It makes the baby chubby. But see, for breast milk babies have a better IQ and
Hmm.
they are as tall as other babies also. So for growth wise, we'll say the length is more important than absolute weight. Right? And we want an appropriate weight. We don't want an inappropriate high weight. So chubby babies might look good on camera, but really they're not very good. So believe in yourself. And if your baby's height is okay, if your baby's weight is good on the growth chart, don't think about other babies also. That their baby is chubby, mine is slim. Slim is good, no? Everybody wants a zero figure now.
Yeah.
So later
Yeah.
on, everybody will get chubby. So let the baby slim be slim right now.
Great. And you interact with so many parents every day, doctor. What would you say are the top three concerns that parents share when they come to you?
Uh, when they like, especially in first initial 2 3 months, everybody will come that baby is not sleeping at night. I say, you believe me or not, they'll not sleep for further than few months. Like they sleep only after 4 5 months of life, and that's called parenthood. And you have to be like them because there are two things: is intrauterine. They were, had rocking movement in the daytime, so they have a habit of sleeping in the daytime. And when they sleep in the daytime, they wake up in the night. And one thing is nature that see we have been living in huts and sometimes without huts. Like I'll say like 100 years back also we were not living in houses, so there were a lot of security issues. Animal from the jungle can come and take our kid. So mother, there has to be somebody to take care to guard the child, and I think so. God has given that gift to the child that they can guard themselves. They'll be awake and they'll keep somebody awake with them. So the babies do need care at the night also. So I
Yeah.
think that's nature, and we should respect nature. Second is my baby is having runny nose since birth, and कभी ठीक ही नहीं हुआ आज तक ये. इसके तो बलगम जम गया है छाती में, और वो बलगम potty में भी निकल रहा है. See, no sputum can come from the potty. The oxygen or windpipe, or we say trachea, is different, and the esophagus, a food pipe, is different. They're never connected. And small babies will never make sputum. If the babies make sputum, they will never they will be, it will be very difficult for them to breathe. So
Right.
I trust me, sputum is not can never come in the potty, can never come in the potty. It was undigested milk that they vomited.
Right.
So they usually say and noisy breathing is a very normal phenomenon. If the baby otherwise is healthy, the baby do not have a respiratory distress, the baby do not have fast breathing, or the baby is feeding well, believe me, your child is well. So just noisy breathing, don't go for medicine. Otherwise, you will have a vicious cycle of medicine. अरे इससे भी ठीक नहीं हो the doctor change कर दिए. I've seen all the doctors of the city, the baby is not getting well because your child was already well.
Yeah. And doctor, you
And
have to tell us what is the funniest or most unusual question a parent has ever asked you?
uh, funniest question is, I have to recall. There are a lot of funny incidents that, you know, yeah, I remember one lady came, she's grandmother, and she came and she asked me, डॉक्टर साहब अभी तो ठीक है, अगर बच्चा बीमार हो गया तो क्या दवाई देंगे. है ना, आई एम नॉट अ ज्योग्राफी which disease they're going to be, baby is going to. Then she told me, you write all the medicine which is possible, और जब बीमारी होगी तो मैं वो दे दूंगी.
That reminds me of us, the parents who are also overwhelmed with so much of information, especially in this digital age. There are so many advices on apps and social media. It's so overwhelming. What do you say to that?
See, social media is an unfiltered thing, and they can be personal opinion also. See,
right,
what we speak is from the evidence. See,
right.
we either, like, it's not just 1%, 2%, whatever comes in the books or literature, it is like thousands, sometimes lakhs, millions of people who have given their opinion. We have seen that, see, any new medicine that we give, first of all, it goes through, healthy human being, animals, then sick, and then it comes for to market for supply. Then also sometimes they are recalled. It's not a
Yeah,
personal experience. So, if you get something on internet, you have to find out, or you have to ask them, what source do you have? Is it a scientific source or it's your personal opinion? Sometimes a baby was not sick, and what I say, the baby had some runny nose, and the baby was not sick, and I made this, I gave this medicine, my baby got well. Baby was not sick to start with.
yeah,
Your baby, I have not never given him any antibiotic till today.
yeah,
So if I had given any antibiotic to a baby, you would have said this antibiotic work. So
yeah,
it can be coincidence also. So you have
yeah,
to ask them, is whatever you're speaking, have you asked your pediatrician? Or do you have any scientific knowledge? Or have you asked other people also, like at least a few hundreds of them? Or it's just your personal experience. Like I told you, a Cerelac, a nuts-based Cerelac, a badam, ye, wo, mix karke Cerelac bana dena, that's not recommended. In fact,
yeah,
that is, contraindicated. So
yeah,
sometimes there are a lot of myths, and any information from the net should be taken, very cautiously, and you should be, unfiltered. It can be dangerous also.
right, right. And I'm
Yes.
very curious, doctor. You have been working so closely with parents, so closely with children, so closely with the small babies. How has all of this shaped your perspective on parenting itself? You are a parent. How has your journey of parenting been shaped by your experiences?
See, what I have learned with lot of experience, most parents are concerned. They're anxious. Yes, it is a natural feeling to be anxious. But believe me, most of babies are fighter. They are not sick, and hardly they get sick unless you try to make them sick. You have to find the soft cues. You have to
Yeah,
find the soft cues. They're not old machines. They are brand new machines. They, and even if they are sick, they get they get recovered very very fast. You have to just see, you have to sail through, make them sail through their journey. Don't be overprotective, don't be overcautious, just feed them nicely. My mantra of life is, most disease get resolved by themselves if the baby is active, if the baby is feeding well, if you feel the baby do not have altered behavior, they'll get well by themselves.
right.
Yes, you do have to take care of their needs. You don't have to make them cry. You don't have to give them unnecessary, let the baby cry. If they become cry, they will be more healthy. No, they will be rude later on. They will not have trust in people.
Yeah,
So, and don't compare your child with other kids. They can, yeah, like his father was tall, so his kid will be tall. It is something as genetics. I'm not tall, my child might not be that tall. My
right,
child will be like me only. You don't have to compare, you don't have to and milestones have ages. Like uh, a child can walk as early as 12 months, or he can walk as late as like 18 months, and both are normal. Your
right.
child, if not walking, he's doing something else. He's talking more than the other child. So
Yeah,
milestones also. Sometimes मेरा बच्चा तो अभी चला भी नहीं है, उसका तो बच्चा भाग रहा है. अरे, he might be a the weight of that child might be a little less, or he might not be talking.
yeah,
And one thing is, with parenting, you have to be parent. You cannot substitute your parenting.
right,
Giving mobile, TV, all those substitute is going to do a lot of harm. That's the biggest hindrance in development of a child.
yeah,
Babies do not need lot of supplements. Unnecessary supplementation is not required, especially for 6 months. Only vitamin D and your feed, nothing else. After 6 months, some iron, yes, is required. Vitamin D is required, but still not a lot of, like, every day they have new medicine, new supplement, new DHA, all those things. Not no, no, not much required. And say you see yourself, how much supplement did you give? Is your IQ a little lesser than what others have, or somebody from the West have? No. So sometimes this company or those the pharma industries is pushing you, use Pediasure, it's good. It's more of addictive than helping. And we
right,
have found out, even in formula in India, they had a lot of sugars.
right.
So and sugar make you addictive.
Yeah.
Sugars made you addictive. So better you give natural homemade food. You be parent to them, not a machine, not a machine. That's what my advice is, and my parenting has been similar. I don't give them any extra, perks. I treat them like a normal parent, like my parents treated me. Is I don't bang them, I don't beat them. Physical assault or beating kids is not a, in fact, counterproductive. They become, rude. They
Yeah.
become bully also, and they see that they feel that this is normal. We should also do it to other kids also.
Right.
Yes, you don't have to give in to their demands. You have to handle them nicely, but there are other ways to feel them that what they're doing is not right. But
Yeah.
it's like after 2 years. Before 2 years, they don't know much. Especially till 1 year, they don't know much.
Yeah.
So punishing them before one year is not a idea at all. Not a good idea at all. Yes.
Thank you, doctor. And doctor, I want to ask you, you said, neonatology came to you, it happened to you. If you weren't a neonatologist, what career would you have pursued?
Uh, I never thought of that way, but yes, I would have been definitely, uh, into, teaching, especially
Mm-hmm.
mathematics. I
Uh-huh.
would have been a mathematic teacher. I was very good at it, and I would have done some other business also apart from that.
Wow. And last question for you, doctor. What's one mantra or piece of advice you live by as both doctor and a person?
Uh, you know, uh, what I as a doctor feel, the first duty of a doctor is to send the baby home.
Wow. How beautiful.
Is to send the baby home, keep babies with you only if they are sick. Get baby to a doctor. Like if you feel the baby is not well, get to the baby to the doctor. And but my advice is for me and my colleagues is we will like to send the baby home as the earliest because that's the best place for them.
Wow.
And to the parents is be parents, don't be overprotective parents, and sometimes small things you have to ignore. Like I'll this question I'll try I'll like to be I'll stretch a little,
Yes,
that some
please.
things is small babies we feel that these things are not normal, and I'll say that these are all normal.
Yeah.
Like babies feed more in night time. They feed like every half and I'm telling about like first for few months, first five
Yeah.
six months. They feed like one every 1 hour, every 2 hour at night, and they don't feed like 3 to 4 in daytime. That's a very normal thing. If the baby is passing urine 6 to 8 times a day, that's normal. Sometimes they spit out milk.
Yeah.
Spitting out a lot of milk many times a day is also normal. So if your baby is feeding and spitting, that's normal. If you burp the child, the spitting will be a little less. Babies, pass potty immediately after feeding. That's called gastrocolic reflex. They might, have frequency of potty as much as like 16 to 18 times a day. That
Wow.
is normal. And like when they're 4 or 5 months, that might decrease to like once in 2 3 days also. That's also normal. If your baby is comfortable passing urine well, then number of potty doesn't matter to me. Only thing is the frequency should not change abruptly. It should be gradually. Like
Right.
yesterday it was 10, then 9, then 7, then 6, then 2, and now the baby is not passing urine for potty for last 2 days, but the baby is otherwise healthy. That's
Right.
normal. That's normal. Noisy breathing, if otherwise do not have any distress, if baby do not have just distress, there's some noisy breathing in the nose. See, baby's nose is just, it's like just thin. Even a drop of water will cause a lot of noise. That doesn't mean anything. That doesn't mean anything. Babies pass a lot of gas. Passing gas is healthy. That means the food is in the colon. It's getting digested. Don't worry about it. Jaundice. Everybody is worried about jaundice. I believe me, every baby who is born, who was born, or will be born, will have some degree of jaundice. Jaundice is not really harmful. It has a lot of antioxidant. Only if jaundice becomes a little higher, like 15, 17, depending on age and how old the baby is from birth, we treat jaundice. Sunlight, it might decrease, but it has harm also, and it may delay the treatment also. I'll not advocate sunlight.
Right.
If the baby has serious jaundice, get the baby treated. It is one of the simplest disease to be treated, but if not treated, the most dreaded of the disease, the most sinister of the disease. Hygiene is the key to baby's health. If you have a small baby at your house, keep washing your hands, maintain hygiene, maintain like hygiene, hand hygiene with the sanitizer, respiratory hygiene. Don't let lot of people come to your house. What see, even in a rural family, still people do not allow people from outside to come there to their house for at least 1.5 months.
Right.
1.5 months. नजर लग जाएगी, नजर लग जाएगी. What was that nazar? That was nazar was some infection. Somebody from outside will carry an infection and we will take it, like catch it, and we will get sick. So
Right.
that is right. So you should try avoiding overcrowding. Celebration you can do later on when the baby is like 6 months, a year. There's life for celebration, but not for first year. Not for first year. So you should always keep your high area clean, and with other babies also. And there's a mantra of like, I belong to Hindu religion. Even with Christian, even with Muslims, before they pray they will wash their hand, after they pray they wash their hand, before they eat they wash their hand. So washing a hand is universal to all religion. So hygiene is universal to everything. So it should be there. Every mother, every child, sorry, not even not child, but every mother or parent should wash their hand with before touching their baby. Use sanitizer if they cannot wash the hand. So
Right.
keep the baby. Don't let the baby get sick. And get more healthy habits. Food also, don't go for artificial food. Make your food at your house. Start with small complementary foods, raw, like boiled, or semi cooked food, like boiled potatoes or boiled sweet potatoes, all those things. We can have all those lists if you wish to. Small with start with all those things, homemade food, because that's going to be for their whole life.
Right. Yeah.
So I'll say that, yeah, you go ahead with all those things.
Thank you, Dr. Hemant. This has been such a fantastic conversation. You've given us so much clarity and practical advice. I think what I feel is parenting can feel so overwhelming at times. And I know today's episode is going to be a source of comfort and confidence for so many listeners.
I am so delighted, so thankful to you. You gave me an opportunity. And parenting should be fun. It should never be a difficult journey. It is one of the most exciting. Yeah, some sleepless nights. Yes, enjoy. I was in college and I didn't purposely sleep at night. Now God has given you a second opportunity not to sleep. Enjoy that opportunity. Why are you worried about that? So take that. I'm a parent and I'm enjoying my college life again. Why? And career should take a back seat for a couple of months. That doesn't harm you, and you will never be delay in your career if you feed your child for 6 months. And you, during parenting, just be a parent, nothing
Thank
else,
you so
just
much.
be a mother.
Thank you.
Thank you so much. Thank you, so nice to talk to you. Thank you so
Yeah,
much.
same here. And to our audience, if you'd like to learn more about Dr. Hemant Sharma or book a consultation, you can find him at Neonatology Department, Amrita Hospital, Faridabad. More details are available in the show notes. Thank you for joining us today, Dr. Hemant. It's been a privilege to have you here.
Thank you so much.
Thank you. And to all parents tuning in, remember that every parenting journey is unique. Trust your instincts, lean on your support system, and know that you are doing an incredible job. If you enjoyed today's episode, please don't forget to subscribe, leave us a review, and share it with someone who might find it inspiring. Until next time, take care and happy parenting.